I think the most important thing to know if you test positive is first, don't panic. There are resources there available to you that can help you. Be sure to isolate after you've tested positive and contact your provider.
There are certain symptoms that you can expect that we see commonly. Those would be headache, fatigue, runny nose, a dry cough, nausea, some vomiting, diarrhea, loss of taste or smell. Those are probably the most common. Some people won't get any symptoms at all.
I think letting your provider know that you have tested positive for COVID is important from the beginning. And when you become more sick, if you have shortness of breath, if you have difficulty with vomiting or diarrhea, keeping fluids down, staying hydrated, those are the kind of things that we would like to work on increasing the level of care that you're receiving.
If your symptoms worsen and there's a true emergency, please contact 911 or go directly to the nearest emergency room. If your symptoms mildly worsen, please contact your provider and we can help you to navigate.
The state of Kentucky has developed guidelines, and we have provided a link to that at the bottom of this page. Basically, if you have been vaccinated and are booster eligible and received your booster, you don't have to quarantine if you don't have symptoms. If you are vaccinated without your booster and or unvaccinated, the plan is to quarantine for 10 days. This can decrease to 5 days if your symptoms have fully resolved, but you're required to wear a well-fitting mask for the other 5 days.
I think that the risk factors that we'd be most concerned with are folks who are overweight, people who are obese or morbidly obese are at greater risk for doing poorly. People who are unvaccinated, unfortunately, do quite a bit more poorly than those folks who have been vaccinated. People who have hypertension, diabetes, people who are immune compromised, people who have respiratory illness, chronic pulmonary disease or cardiac disease, those folks are at greater risk for doing poorly with COVID-19 infection.
The easiest thing that you can do and the best thing that you can do is to access your medical record through MyChart. MyChart will allow you to contact your primary physician to discuss treatment plans and to make sure that your symptoms are being communicated to your medical team.
Your best way to avoid having serious complications from COVID-19 is to be vaccinated, and if you have been vaccinated, to be boosted. Those are our greatest ways to avoid serious illness with COVID-19.